Have you seen those commercials? You know, the ones with the oddly smiling people that are dancing in the field or playing with their animals, when all of a sudden a very monotonous voice starts listing off some pretty scary and serious side effects, some even including death. And you wonder, what in the world is this commercial for? Well, come to find out, it's for a drug that a big pharmaceutical company, otherwise dubbed as Big Pharma, is pushing. And it raises the question whether Big Pharma is in it for curing the patients or finding clients. The answer is simple. They're finding clients. And that is shown through the hepatitis C treatment scandal and the recent opioid crisis. Just like any business, Big Pharma looks at how profitable their products will be, how much they can charge for it, and how their stream of revenue will be impacted based on the effectiveness of their product. As a result, they know they can charge exorbitant prices for treatments involving rare diseases and cancer, such as $400,000 a year per patient, or even up to $1 million per treatment. This has negative repercussions inasmuch as the number of patients cannot afford these treatments and will remain ill or even die at the hands of Big Pharma. And the focus of the more profitable rare diseases and cancer result in a lapse in development in other more common areas, where second-rate treatments remain the norm at the expense of the patients. It's easy to see how profit-minded businessmen in the pharmaceutical field will question whether curing patients, therefore losing clients, is really the best business model. This is illustrated through the hepatitis C treatment scandal. In 2013, Gilead Science introduced a revolutionary cure for hepatitis C called Sovaldi, and they later released another drug called Harvoni. Shortly thereafter, another company called AbbVie released its own version of these drugs that was supposed to produce the same result. However, AbbVie's product didn't work as well as Gilead's, which therefore drew the interest of Wall Street. Inasmuch as AbbVie's product produced an inferior product that didn't actually cure hepatitis C, but rather only treated the symptoms and required long-term maintenance, Wall Street quickly became much more interested in AbbVie's product over Gilead's. As a result, investors clamored to AbbVie, and profits for Gilead have fallen ever since. The problem lies in not only pharmaceutical companies themselves, but also in the investors. Many are not eager to invest money in products that will cure over 90% of its pool of clientele, because, again, it's not a sound business model. Rather, investors are far more interested in drugs that cure nothing, but instead promote dependency and long-term use. Sound familiar? That's because it is. They are called opioids. Purdue Pharma, owned by the Slacker family, produces OxyContin, its main ingredient being oxycodone, which is most widely prescribed opioid and one of the biggest contributing factors, if not the biggest contributing factor, for the recent opioid epidemic. In 2017, in the opioid crisis, in an article entitled "An Empire Pain," the New Yorker exposed Purdue Pharma and the Slacker family as the great villain in the crisis. In essence, they introduced OxyContin in 1996 as a long-acting form of oxycodone and heavily promoted it as being relatively safe from abuse and long-acting. These claims were clearly false, resulting in Purdue Pharma being sued by the state of Massachusetts. In short, it's very evident that these big pharmaceutical companies are looking for clients and not cures. They may want to rethink their branding and their marketing and commercials and not have those people smiling as wide as they are.